Steve Carterson came up with this. I hadn't really had heard about this, but there's about 1.7 million PAPs sold in the United States. 820,000 of them are abandoned. So the success rate's about 52%, 48% of them are abandoned, and there's only about 110 claims for EO486, which is the oral appliance for sleep apnea. I thought those figures were kind of interesting. So about 13.4% of the people actually abandon this, and there's a huge difference between this number and this number. These people that have abandoned or intolerate, they should be, maybe they get some other kind of therapy, but a lot of them probably should be looking at a oral appliance therapy, maybe on some of those. Now, the other is something that Dr. Gimeno talked about a lot, about obstructions. Of course, adenoids and tonsils are about 60% of the problem. Turbinates about 18%, deviated septums, sinus inflammations such as allergies. All these improve, and a lot of them improve them a lot once these things are taken care of. Even the openings of the nose, when the opening of the nose is small, the child can't breathe through the nose. Early dentofacial growth therapy. This is something that Dr. Gimeno talked about a lot, as far as a significant improvement, if not a cure, but early growth guidance. I mean, early as you can get, as you feel comfortable treating these, to do some early dentofacial orthopedics, myofunctional therapy, habit correction. And in my mind, what does this do? It mimics MMA surgery or mandibular advancement surgery. So if this is a major fix, so to speak, for people that have obstructive sleep apnea, why wouldn't it be something that we try to mimic in our children? And you got to do it early. You can't do it at 12 or 14. You got to do it, believe it or not, at 5 years of age, 50% of facial growth is complete. By 8 years of age, 80% is complete. And by 12 or 14, normal orthodontic age, 95% of their facial growth is complete. So no wonder we have to do some other kind of stuff on some of the orthodontic age patients. Expansion, early RPE, reverse face mask, functional appliance treatment, myofunctional therapy,